Hey, you guys, welcome to day 24 of our March Madness practice questions. As always, I like to give my intro and disclaimer before getting started. For those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and founder and CEO of the Nursing Studio. I assist nurses as well as nurse practitioners with being successful on boards as well as in practice. I've been doing this since 2015, helping nurses and nurse practitioners internationally with success. And I do various courses and videos, but I always like to give the disclaimer to remind you that, there's no absolutes in medicines. We treat on a patient by patient basis, and I design questions based on the current guidelines that are being tested on the actual exam right now. And if I'm teaching on practice items and things that we are doing currently in practice, I will tell you that to clarify so there's no confusion, okay? So keep that in mind as we get into the questions. All right. Question number one. I'll let it come up a little bit. All right. It says a patient presents to the office for follow up today. He has a history of hypertension, COPD, diabetes, and seasonal allergies. He has a history of angioedema with ACE inhibitors. On exam today, his blood pressure is 146 over 92. What will be the next best medication to add into his regimen? Is it A, lisinopril, B, amlodipine, C, valsartan, or D, chlorothalidone? Take a moment and tell me what you got in the comments, you guys. All right, you guys, I always and recommend that you read the stem of the question first to slow yourself down and ensure that you're answering what is even being asked. So the stem of the question here states what would be the next best medication to add to his regimen. So what do we have going on? I tell you, if we're talking about treatment, we need to think of the diagnosis, how the patient present first, right? Because we're always thinking assessment, diagnosis, evaluation, treatment. So here we know this is talking about hypertension. His blood pressure is still elevated. We need to think about it. He already has comorbidities. So think, hey, ACC and AHA guidelines say if they have comorbidities, we do not want their blood pressure to exceed 130 over 90, right? So here it's exceeding that. So we need treatment. And it also lets us know that he's had angioedema to ACE inhibitors in the past. All right, so we're starting to formulate all these things in our mind. So one, you need to think ACE inhibitors end in pril. So you can eliminate A, lisinopril, right? Because he's got an allergy. We're not trying to cause any more issues, right? Also, you need to think, hey, this person has a history of diabetes. With diabetes, our diabetic patients, it is recommended that we treat with an ACE or an ARB when managing hypertension to help to protect their kidneys. So you need to look for that ARB if they're not tolerating that ACE, right? So C is your best answer, valsartan, remembering that ARBs end in sartan. Know your endings. It'll help you. And trust me. And when I tell you, studying pharm, don't make pharmacology a whole nother system to study. Study it as you are, studying the actual condition. If you do it like that, it gives a little bit more ease because you're grouping everything together. And if you think in the format of how I tell you to review and how I teach and do my courses, if you're going assessment, diagnosis, evaluation, treatment, that is what is going to be your ticket, right? So if you're doing the treatment that way, farm doesn't have to be something separate. It just makes it a lot more overwhelming because then you're trying to study the drug class, study, its contraindications, the mechanism of action, all the things, and then apply it to a group. But if you're studying all those things with the group, it's just tying it all together, right? Trust me. Trust me. All right, question number 2, you guys. A 39-year-old female presents to the office today for follow-up. She mentions that she is nervous and does not want to start mammograms yet. She denies any family history of breast cancer. After completing her assessment, the nurse practitioner notes that the patient does not have any current risk factors for breast cancer. What would be the best response to the patient's hesitancy to mammograms? Is it A, explain that she has 1 year and must start at the age of 40? B, tell her she doesn't have any risk factors, so don't worry about mammograms. C, explain mammograms to alleviate nervousness and explain since she doesn't have any current risk factors, she can wait until the age of 50. Or D, avoid and revisit this next year. Take a moment and tell me what you got in the comments. Don't be shy. Tell me what you got. Tell me what you got. All right, stem of the question states, what would be the best response to the patient's hesitancy to mammograms? All right, so what are we thinking about here? This patient is 39 years old. We need to think about when do we even initiate mammograms? When is it recommended? Age of 40, doing mammograms annually, right, is a standard. All right, so yes, she does have another year. She doesn't have any risk factors. So A says explain that she has 1 year and must start at 40. Yes, she does have 1 year, but she does not have to start at 40, does she? Nobody has to do anything. And when we are communicating therapeutically, you need to keep the patient. Number one, patient-centered care is the main thing they're testing on with questions like these, and therapeutic communication. So we are providing patients with the information they need so that they can make a sound decision. But we're not telling you that you got to do something, right? So you have to do this. But so you can eliminate A. B says tell her she doesn't have any risk factors, so she doesn't have to worry about mammograms. All right, again, partially correct. She doesn't have any risk factors, but you do want them to take mammograms to be sure that you don't have any issues or complications. This is a preventative screening exam for a reason, right? So you can eliminate B. C says explain mammograms to alleviate nervousness, and explain since she doesn't have any current risk factors, she can wait until 50 years of age. Ding, 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 ding. C is your answer. When you're thinking about mammograms, know that the recommendations currently are that 40 years of age is when you should start and complete annually. If they do not have any risk factors, they can start at the age of 50, but you always explain the benefits and the risk. Hey, the longer you wait, you may miss something even if you don't have risk factors. But if it's for some reason that you don't want to start at 40, you can wait to 50 because you do not have risk factors, right? Explain what the test is because it says here that the patient is nervous about having it done. Maybe just explaining what it entails will alleviate the nervousness. She may want to go ahead at the age of 40, but also if they have a family history of breast cancer with immediate family members, mother, sister, aunts, grandmothers, things like that, then they need to start 10 years prior to that person's diagnosis, right? And then you can see D says avoid and revisit. We don't avoid anything. You need to address what is being discussed. All right. All right. And then question number 3 for our third question for today. A patient presents to the office today with complaints of a migraine headache. Patient states that he has been avoiding treatment, but would like to know the best treatment for this excruciating headache. What is the correct treatment for abortive therapy? Is it A, Elavil, B, Depakote, C, sumatriptan, or D, prednisone? Take a moment and tell me what you got in the comments. All right, similar question states, what is the correct treatment for abortive therapy? That is the key. We're talking about migraines, but abortive therapy, knowing abortive versus prophylactic, don't miss it. So you should instantly say C, sumatriptan, because triptans are the abortive therapy, first line therapy for migraine headaches, right? All right, you guys. That is all. I hope you found that helpful for today. As always, be sure to meet me back here. We're still pushing through our March Madness, and we've been trucking along. Loving that y'all sticking with me and enjoying this. But be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. And make sure that you meet me back here if you need any of our resources or assistance to help you to go from unsuccessful to successful on boards, or just to tidy up some of those weaknesses to make them strengths. We offer self-paced courses online. We offer a 5-week intensive review that's starting April the 8th. We also offer one-on-one sessions. The most common package of our one-on-one session is the custom one, where we design stuff structured off of your previous unsuccessful test. And weaknesses that we noticed from our pretest. And then we design packages and work alongside you to help you get to a successful test. But if you need any of those resources, reach out to the Nursing Studio at 803-400-6864 or shoot us an email at the nursing studio, the number 1 at gmail.com. All right. Bye, y'all. Happy studying.